Hi, my name is Angelina Viola, and I'm going to be presenting on toxoplasmosis. So what is toxoplasmosis? It's a zoonotic infection, one of the most common human parasitic infections in the world. It infects 30% of the world's population. Usually it causes flu-like symptoms or people are asymptomatic, but it can cause severe symptoms in continuously transmitted cases or in immunocompromised individuals. So this parasitic infection has a lytic and latent phase, which if you are immunocompromised can be reactivated. So our infectious agent is called Toxoplasma gondii, and the word toxoplasma originates from the Greek word toxin, meaning bow. And if we look at the parasite, it's actually bow-shaped, which I think is really interesting. And so here's our taxonomy, and it's 5 to 15 micrometers in diameter. It's a protozoan parasite, meaning it's classified as in the unicellular category. And it can infect most species of warm-blooded animals, persists in the CNS, and it undergoes both sexual and asexual reproduction, depending on what its host is, which we'll get into in a minute. So a little bit about the history. Toxoplasmosis was discovered in 1908. Well, excuse me, Toxoplasma gondii was discovered in 1908. We didn't know much about it or what it did until 1939, when the first case of toxoplasmosis was discovered. So its full life cycle actually wasn't discovered until 1970, which was pretty recent. So that's kind of amazing. So T. gondii has three infective forms: the tachyocyte, which is the rapidly reproducing form. This invades and kills the host cells and persists for 5 to 23 days. And then the bradiozoite are tachyozoites that develop into tissue cysts and persist in the tissues for all of the host's remaining life. They usually remain latent, but if you're immunocompromised, they can reactivate, which we'll get into in a little bit. And then the sporozoites are the sexual form of the parasite that become enclosed in a cyst called an oocyst, which can only be found in cats, interestingly enough. So cats become infected by ingesting animals like mice that contain these bradiozoites. And then the bradiozoites develop into sporozoites in the cat's intestine, and then the cat is able to shed these oocytes through their feces. And you may be wondering, why cats? So the only definitive host of toxoplasmosis, meaning the only host where Toxoplasma gondii can complete their life cycle, is in cats. And that's because they have an abundance of this thing called linoleic acid, which the parasite needs in order to complete its life cycle. And most mammals metabolize linoleic acid as they uptake their food, but cats do not, making it a very susceptible host for Toxoplasma gondii. So mammals and birds can be intermediate hosts and contain the immature form, so the bradiozoites, but they can never contain the mature form like the cats can. So here's just a diagram, like life cycle. Excuse me. So cats ingest the mouse containing the bradiocytes or the tissue cysts, and then the cyst wall is digested by the stomach and intestines, releasing these bradiocytes. And then the bradiocytes invade the epithelial cells where they undergo sexual reproduction. And then they create these oocysts, which are expelled in cat feces. And then after 1 to 5 days, these oocysts hatch and become infective. So speaking of transmission, there's foodborne transmission where humans consume undercooked meat or drink unpasteurized goat's milk, which contains the bradiocyte form of the disease, of the parasite. And there's directly zoonotic transmission where humans consume the oocytes in feline fecal matter by not washing their hands after changing a litter box or just coming into contact with the feline feces and not washing their hands. So if you ingest contaminated soil that's come into contact with the feces by not washing your fruits and vegetables properly, you can get it, or by ingesting contaminated water is another way of transmission. So congenial transmission is mother to child transmission through the placenta. This is the only type of person-to-person transmission that we can have. The mother is often asymptomatic, and there are also rare cases of transmission where blood transfusion or an organ transplant comes into play, but there are very few cases of this happening. So in a healthy individual, the symptoms are often misdiagnosed because they show up like the common cold or the flu. You get a fever, headache, swollen tonsils, muscle aches. The incubation period is 5 to 23 days, and so symptoms will last for weeks, sometimes months in severe cases, but often not. People are often asymptomatic. So the immune response is primarily Th1 type cell-mediated response, and it depends on the production of IL-12 and this cytokine called interferon gamma. So interferon gamma activates macrophages to help control the parasite. And so in AIDS patients, the CD4 plus levels decline, and so the production of this interferon gamma also does, and they can't fight the disease as well, which makes sense as to why we will see it reactivated in the latent phase. So pregnant women who come into contact with toxoplasmosis may have a miscarriage or give birth to a stillborn. But if their child is stillborn, they often have symptoms with congenital toxoplasmosis. So in the first trimester, there's a 10 to 15% chance of transmission between the mother and the fetus. And there's often very large birth defects like microcephaly or macrocephaly. Macrocephaly is here, there's an enlarged brain, and so the head will be much larger to the proportion of the body. And then microcephaly is the exact opposite, as to where the head will be very, very small in proportion to the rest of the body. In the third trimester, there's a 60% chance of transmission, so much higher, and this may cause ocular, visceral, or intracranial lesions. Symptoms also include jaundice, hydrocephalus, chorioretinus, hearing loss, motor skill issues, development and intellectual delays, seizures, and in most cases, children don't show symptoms at birth, but have repercussions of congenital toxoplasmosis later on in life. This affects 400 to 4,000 babies per year in the US alone. So ocular toxoplasmosis is something that shows up often in immunocompromised individuals that are infected and congenitally transmitted toxoplasmosis. So some healthy individuals get it, but it's very rare. When parasites reach the retina, they proliferate the host cells, causing them to rupture, and they create these eye lesions, which can lead to partial or full blindness, blurred vision, or eye inflammation. And so here we see an active infection, and then these are the scars from the lesions, which are permanent. And unfortunately, once vision loss of ocular toxoplasmosis has begun, there's no way to regress the symptoms. And so you can't get your sight back, though you can be treated for the eye inflammation and the uncomfort. So toxoplasmic encephalitis is often seen in immunocompromised individuals, especially those with AIDS. And this is when the tissue cysts become reactivated later on in life. This is when these bradiocytes, like I said, reactivate. And so when infected dendritic cells and macrophages travel to the brain, they infect the neurons, causing them to inflame. And this causes headache, fever, muscle weakness, can also cause personality changes, speech impairment, seizures, and stuff as serious as dementia. Toxoplasmosis has also been linked to schizophrenia by some scientists. And though there's no real concrete evidence for it, this is kind of where the term crazy cat lady is thought to have come from, which is really interesting. So I thought I'd put that fun fact in there. For a diagnosis and treatment, diagnosis is usually done by serologic testing or a test that measures the IgG levels. And direct observation of the parasite can be done through stained tissue sections or CSF or other biopsy material, but this is used much less frequently. And in pregnant mothers, molecular techniques can be used to detect the parasites in DNA and in the DNA in the amniotic fluid. So for treatment, most healthy people recover from toxoplasmosis on their own, but in cases with ocular lesions or other serious symptoms, they can be treated with pyrimethamine or sulfadiazine. And newborns are also treated with this. It's usually coupled with folic acid to protect from bone marrow loss, which are just normal side effects of pyrimethamine and sulfadiazine. So mothers can be treated with sparamycin to prevent congenital toxoplasmosis as well. Unfortunately, there's no vaccine currently for toxoplasmosis. So what can we do? We can ensure that our food is cooked properly. Don't drink untreated water. Wash your fruits and vegetables. Wash your hands after scooping your litter box. Wear gloves when working in soil. Don't feed your cats raw meat. Make sure that they're eating canned food or dry food that's come packaged in a store. Ensure that the litter box is changed daily. I mentioned this previously, but the Toxoplasma parasite does not become infectious in those oocysts until 1 to 5 days after it's shed in the cat feces. And if you're pregnant or immunocompromised, don't get a new cat. Don't handle stray cats. Avoid changing your litter box when you can. If you have to, wear gloves and wash your hands thoroughly. So let's talk about the prevalence incidence a little bit. So there's an increased number of cases where there are hot climates and low elevation. That's because the T. gondii parasite really likes these conditions to grow in. And so South and Central America also have a higher number of cases due to their stray cat population. We can see that here. And France also has the highest number of foodborne toxoplasmosis cases. 80% of their population contains this due to the high consumption of raw meat in French culture. Women at the reproductive age are most at risk to spread toxoplasmosis. We're not worried so much that the mother is going to be severely infected, but more that she's going to pass it on to her child. In the US, 1.1 million people are diagnosed with toxoplasmosis per year. So a little bit on the research and future outlook. So since toxoplasmosis is still kind of newly discovered in as far as parasites and diseases go, it's still actively being researched to find better cures and prevention, most especially for congenital toxoplasmosis. So far, there's been an effort just to spread awareness to keep cats out of barn houses that are used for food production, and also to implement good farming techniques, because there's been a recent discovery of toxoplasmosis in sea otters, meaning the T. gondii parasite has contaminated our oceans. Predictions suggest that this comes from soil runoff into our seas, and so by implementing good farming techniques, we're actually able to stop the soil runoff and stop infecting our aquatic animals. And so I've been reading a lot about the talk of a vaccine being developed for humans, livestock, and cats. Although there's no concrete scientific evidence that this will happen, we can hope, and there is talk of a vaccine being developed, hopefully soon. Anyway, that's it for my presentation. Thank you so much for listening, and I hope you enjoyed. Don't be scared of cats, but definitely be careful when you're changing the litter box. Be careful what you're feeding them, and most importantly, just wash your hands, have good hygiene.